Hi everyone, thanks for tuning in to our COVID-19 stats video for the CDC Week 44. My name is Sara, epidemiologist at the Jefferson County Health Department. This report includes data from Sunday, October 25th to Saturday, October 31st. The weekly total COVID-19 surveillance report includes our community-based cases as well as those long-term care facility cases. During week 44, we had a total of 673 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is 6,611 cases as of Saturday, October 31st. We are reporting 84 COVID-19 associated deaths as of week 44 and 22 outbreaks in the long-term care facilities. Let's start with the number of confirmed and probable cases by week in Table 1. Looking down at the bottom of our table, we'll see that total for week 44, 673 cases for the week is the highest total that we have seen since the beginning of the COVID-19 pandemic. And it is especially disheartening to see as we begin to move into the holiday season. One thing I would like to clarify, a lot of people wonder why the probables are included in our count. And just as a reminder, the CDC did update their case definitions back in August, and they include antigen tests in their probable case classification. So if you go out and you get an antigen test somewhere and receive a positive result, you are included on our list as a probable case and are not included on our lab confirmed count. The antigen tests are still very valuable and accurate, but we are just following the CDC's guidelines when it comes to the actual case classification. This also means that the individuals who receive a positive antigen test result are not included in our positivity rate. So please be aware of that as well. The probable count is very important to include, especially since the CDC now includes those antigen positives in that bunch. In Figure 1, we see the confirmed and probable cases by week in bar graph form. Once again, you see this past week's total, which is much higher than any other week that we have reported so far. I know with holiday season approaching and everybody just kind of quite tired of the changes that the pandemic has brought, but these numbers are proof that we really need to continue to be mindful and continue our mask wearing, our social distancing practices as much as we can. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The actual number of cases per day is seen as indicated by that dotted blue line, and the solid blue line is the 7-day rolling average. Right before Halloween, we had a few days where that daily case count spiked to over 100 cases per day. We even had one day where the count was close to 200 cases. The 7-day rolling average of cases is one of the main indicators used for that color guidance chart for our county. And because of the high increase in daily cases, we are well over that threshold that puts us in the red status. Next, let's look at the overall age group data in Figure 4. You can see that we actually have 3 age groups now that are very close in total number of cases. The 20 to 29 year age group, the 40 to 49 group, and the 50 to 59 group all have totals over 1,000 cases at this point. Each age group experienced around a 10 to 13% increase in cases, except for that 80 plus age group. That 80 plus age group only experienced a 4% increase. So what this is telling us is that we are seeing more and more of the younger individuals being affected. In Figure 5, we will be looking at the fatalities and the fatality rate by age. There are 84 reported deaths in our county, most of which have been in our 80 plus age group. This total was current as of Saturday, October 31st. As we stated in a recent press release regarding the deaths in our county, we will be updating that number each Wednesday, and you can find that information on our website and on our social media accounts. Our cumulative fatality rate in Jefferson County is 1.27%. Missouri's fatality rate is 1.61%, and the fatality rate for the U.S. is 2.51%. Though some may look at those numbers and think that percentage is very small, please keep in mind that we are dealing with a preventable disease, and by taking very easy measures such as the mask wearing, the hand washing, the physical distancing, we can prevent any unnecessary deaths due to this disease. Moving on to figure 4, we have the COVID-19 PCR test results by week, as well as a visual of that percent positive rate. This data does only include those PCR lab confirmed cases. So remember that this does not include any of the probables, any of those antibody positive tests, or any of the antigen positive tests. The percent positive is currently sitting at 20.4%, which is much higher than we've seen, as indicated by that very steep increase at the end of the graph in that dark blue dashed line. Table 3 is where we can see the actual values of those positive tests, negative tests, and the weekly percent positive rate. During 44, we had 604 lab confirmed positive cases, and the percent positive for the week was 20.4%. As I always say, this number will likely change over the course of the next week or so as we continue to get those negative results in from the state. But I wouldn't expect it to go down much given the very high number of positives this past week. As you can see, we've had about 2,800 negatives for the past 3 to 4 weeks. So even if we do get a few hundred more negative results, that still would only make our percent positive around 17%. Any positivity rate over 10% is flagged as lead according to the White House Pandemic Task Force. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation or quarantine period. We have a few areas who have higher amounts of cumulative cases. Those areas are Arnold, DeSoto, Fenton, Festus, and Imperial. Many of these areas also have a high number of active cases at the moment. So if you focus on those orange bars, you can see we have 4 areas that have over 100 active cases. Arnold 63010 has 186 active cases. Fenton 63026 has 107 active cases. Festus 63028 has 160 active cases. And Imperial 63052 has 163 active cases. For the last piece of our main weekly surveillance report, we will look at cases by zip code per 10,000 residents. The rate per 10,000 takes the population of each individual zip code into account. This helps to give a better comparison among some of those areas that may have higher populations or smaller populations. Herculaneum 63048 is the area you see there with the highest rate per 10,000. But many other areas do have a pretty similar rate in the 200s and the 300s. Next, let's look at the current school-aged population data. As of week 44, there have been a total of 901 lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. During week 44, there were 103 cases reported for the 0 to 19-year-olds, which is the highest weekly total that we have seen thus far for this age group. In figure 2, we have the cumulative cases and active cases by zip code for our 0 to 19-year age group. Let's focus on those orange active cases, so the cases that have not yet been released from isolation or quarantine. Festus 63028 has the most active cases with 30, and a couple other areas have close to 20 active cases. And those two areas are Arnold and Imperial. When we look at figure 8, we see each of the age-based grade levels divided up and the 7-day rolling average of cases for each of these groups. Looking closely at the end of our graph, you'll see the trends of how those daily case counts are moving. The high school age students are shown there in yellow and have the highest amount of daily cases. But each of the other groups are also showing an increase in the 7-day rolling average of cases, because you can see that their trend lines are all moving upward towards the end there. Lastly, let's review the weekly community-based surveillance report, which excludes the long-term care facilities. In figure 1, we see the weekly case count excluding the long-term care facility cases. During week 44, 646 cases were community-based cases, which means that 27 of our cases this past week were found in the long-term care facilities. Those cases do come from both the residents and the staff of those facilities. At this stage, we can confidently say that this is not a disease that is just affecting our elderly and our long-term care population. 646 cases were associated with that general community. When we look at the age group data for our community-based cases, once again, that 20 to 29-year age group has the most cases with 997. But we are definitely seeing the other age groups with a fair amount of cases as well. At this point, 4 of our 9 specific age groups have case totals in the 900s. The 20 to 29-year age group has the highest rate for 10,000 when we exclude the long-term care facilities. Figure 5 shows the fatalities and the fatality rate by age group for our community-based cases, excluding the long-term care facilities. 31 of the 84 deaths in our community were community-based, and this puts the fatality rate for Jefferson County, excluding long-term care facilities, at 0.52%. The last of our graphs we will look at today include the zip code data excluding the long-term care facilities. The areas that you see with the highest numbers of cumulative cases in the community are Arnold 63010, Festus 63028, and Imperial 63052. These areas all have above 700 cumulative cases. I would like to encourage everyone to follow along with the St. Louis Pandemic Task Force for information regarding our local hospital systems. Jefferson County residents are included in these reports, and these are wonderful reports because they show what is happening in the hospitals in the St. Louis and surrounding areas. We do have many residents who utilize St. Louis area hospitals, so it is important to look at that overall picture for our area if we want to get an accurate idea of the hospital resource availability. Thank you all for listening and watching our stats report this evening. Please be sure to refer back to our website, jeffcohealth.org, for more details and recommendations on COVID-19. We certainly cannot fight this disease alone, and the effort of each individual person makes a difference. So I encourage you all to continue doing your part. Leave us any questions that you may have in the comments or reach out to us via direct message. Have a safe and healthy rest of the week. And thanks again for spending this time with us. Have a great night.